We've made some wonderful and very exciting advances in the ways of being able to detect breast cancer and ways to treat breast cancer. In terms of detection, we have some very exciting new imaging modalities. Some of these are modifications of the standard mammograms. Some of them are completely different in breast imaging modalities, such as breast magnetic resonance imaging or breast MRI, and other technologies such as breast molecular imaging. These are all exciting, innovative ways to evaluate the breast and detect breast cancers at an earlier stage. In terms of treating breast cancers, we have improvements in the surgical management of breast cancer and in terms of ways to deliver radiation treatment for breast cancer, and we also have improvements in the medical treatments for breast cancer. In surgical management of breast cancer, we have less extensive but equally safe ways of evaluating the lymph nodes or the glands in the underarm of a breast cancer patient. And evaluating these lymph nodes is critical for most breast cancer patients because determining whether or not the cancer has involved the lymph nodes or the glands of the underarm is one important way to determine which women require chemotherapy. We used to have to do an operation where we basically removed the entire fat pad of the underarm in a breast cancer patient, and that operation would leave the patients at risk for a problem called lymphedema, which is the risk of having swelling in the arm on that side. And this can be a very, very uncomfortable problem for patients. Now we are able to limit the extent of the surgery that's necessary in the underarm of a breast cancer patient by performing a procedure called a sentinel lymph node biopsy, where we identify and then remove just the most important lymph nodes that are responsible for draining that woman's breast cancer, and we can then stage the cancer appropriately, but leave the woman at a substantially lower risk of ever having to experience lymphedema. In terms of the surgery to the breast, we have wonderful ways of breast-saving surgical procedures that we can offer a patient, and we have better ways of performing breast-saving procedures, such as lumpectomies. We will sometimes work with plastic surgeons to perform lumpectomies on the breast that are less disfiguring to a patient, and these are called oncoplastic lumpectomy operations. When we perform a lumpectomy in a breast cancer patient, we generally have to give radiation to the breast after that lumpectomy has been performed, and the whole point of the radiation is to kill the microscopic invisible cancer cells that are hiding in otherwise normal appearing breast tissue. And survival from breast cancer is actually exactly the same regardless of whether the woman chooses to undergo the lumpectomy and radiation treatments or mastectomy surgery. And survival is the same because of the fact that the life-threatening aspect of breast cancer tends to be driven by the biologic aggressiveness of the cancer and whether or not the cancer can ever metastasize. Now, not every woman is a perfect candidate for lumpectomy surgery, however. Some women cannot receive radiation treatments. Some women simply do not have access to radiation treatments because of geography or because of other issues making it difficult for them to go to the radiation center on a regular basis. Some women have particular patterns of breast cancer where they cannot undergo a lumpectomy followed by radiation. For these women, or for women who simply choose to undergo mastectomy surgery because it's their personal preference, we always want these women to seek the attention of a plastic surgeon to evaluate their breast reconstruction options. And we have some fabulous advances in terms of breast reconstruction surgery for mastectomy patients. A lot of that reconstruction can be done at the same time as the mastectomy, which is what we call immediate breast reconstruction. But the door is never closed to breast reconstruction in a mastectomy patient. Some women will have the mastectomy surgery and then return to the operating room months or years later, depending on the individual circumstances, to then have that reconstruction in a delayed fashion. Some breast reconstruction is performed using implant types of reconstruction. Other types of reconstruction involve rotating tissue from the patient's own body up to the chest wall to recreate that breast mound. This can involve using tissue from the patient's abdomen, or it can involve using tissue from the back. In some patients, it will even involve taking tissue from the buttocks or the thighs that is then utilized to recreate the breast mound. Breast reconstruction options are becoming more advanced every year.